Hi, thank you for taking the time to click on this video today. We are excited for you that you are looking at this new journey of finding support for your mental health. And we do know that there's so many options that sometimes it's a bit confusing. So we wanted to offer you some support in making those decisions for yourself. So let's talk about the different levels of care within the mental health spectrum. It starts off really with what you're probably most familiar with, which is outpatient counseling. So this is your traditional once a week, every other week, maybe monthly individual counseling sessions with a local provider. And so this is for someone who has some mild symptoms, maybe needs a little bit more support in stabilizing, but mostly can manage in their day-to-day life. And so you might find yourself there. However, you also may find I need more support than that. And the good news is there's care for that too. So we have intensive outpatient counseling, sometimes called IOP. And that's for someone whose symptoms are a little bit more than they're able to manage in their usual day. And so maybe you're having some trouble at work or at home in relationships, and your symptoms need a little bit more than what you can get in a weekly outpatient session for about 50 minutes. And so we're here to support that need. We also have partial hospitalization program. That's a step up from the IOP. It's more intense, and this is someone who's really struggling to the degree that if I don't get help, I probably will end up in acute hospitalization or maybe even a residential inpatient placement. And so there are supports for that too. Now, if you find yourself in imminent danger or harm, maybe even having some suicidal thoughts, those are things that you can have an immediate resource for. So there are places where you can get acute treatment, maybe your local ER or even a mental health emergency care location. So those are options as well. And then the highest level of care is residential placement. And so within the residential treatment center placement, that's for individuals who really need 24-hour monitoring. And so you are not in your home setting, but in a facility where they can provide you the ongoing support that you need. And so with all that being said, there are lots of things to choose from. The good thing is we're here to help you with that. And so with Pasadena Villa, we do offer a variety of services, IOP and PHP included. And so in those services, it's really group counseling based so that you can get some support and be around folks who understand what you're going through at a different level. You guys can reach out, you can encourage one another, grow from each other's experiences, and we use lots of different ways to achieve that. We use CBT and DBT and ACT. All of those are counseling modalities that you get to learn about. And then you get to figure out, how do I make that real in my life? How do I apply this in a way that I can see the change that I want to see? And so we're here to support that. With our PHP level of care, that higher level of care, you also get to work with a psychiatrist. So we can do evaluations, we can support with medication management, and it's really a place for stabilization. Let us do what we can do to support you in a short-term placement, 5 to 6 weeks. And at the end of the day, you get to go home to your family. You get to try to practice those skills that you've learned and then come back and have the support to figure out how to continue to make that work best for you. So we have a lot of opportunities for you. I'm sure you're still wondering, okay, so now what do I do? What is next? So what we do want you to do is check out our website at odysseybehavioralhealth.com. You'll be able to see all of the services that we offer in all of the locations across the country. We even have virtual options for you. So for individuals who may not be able to adjust their work schedule or maybe have medical needs that need attending to during the day, maybe you live too far from a physical location, we have a virtual option for you as well. So go to the website, check out the best center for you, give us a call. Our admissions team will work with you. They will tell you about the center and all that we offer. They will also do a screening to figure out, is this the best placement for your needs? And then we'll be able to, as a clinical team, give you a recommendation. Do we think that we have the supports here for you? If so, we'll get started immediately, finish out the process, and figure out an admission date. If it's not quite the right fit, do not worry. We're going to help you figure out what is the good fit for you. So either way, what I would want for you to do today is to give us a call, because you don't have to do this alone, and help is just a phone call away. Talk to you soon.